Welcome back to the Explorer, Life and Learning Hub. Today, we're diving deep into a topic that affects millions of people worldwide: endometriosis. If you've been experiencing painful periods, unexplained fatigue, or digestive issues that seem to flare up with your cycle, this video is for you. We'll be covering 5 key topics, so stay tuned. So, what is endometriosis and what are the most common symptoms? Endometriosis is a chronic inflammatory disease affecting millions of people with periods. It is a condition where tissue similar to the uterine lining grows outside the uterus in other parts of the body. This tissue can be found on the ovaries, fallopian tubes, intestines, bladder, bowels, and even, in rare cases, the lungs and brain. And because this tissue responds to hormonal changes, it can cause pain, swelling, and even scarring over time. Scientists are still trying to understand why some people develop endometriosis while others don't. It's a common condition that can develop at any age while you have periods. Normally, during your period, the lining of your womb sheds and leaves your body. But with endometriosis, this misplaced tissue doesn't exit. Instead, it builds up, causing inflammation, scarring, and pain. If your period pain is stopping you from working, studying, or enjoying life, that's not normal and could be a sign of endometriosis. The most common symptom of endometriosis is pain. Pain with periods is usually severe pain in your lower tummy or back and is referred to as pelvic pain. Pain during or after intercourse. Pain when using the bathroom to pee or poo. Pain so intense that it makes you feel sick. The key red flag is pain that worsens around your menstrual cycle. However, not everyone with endometriosis experiences pain. This is one reason why some cases go undiagnosed for years. Other very common symptoms include irregular periods, fatigue, bowel, and bladder issues. Unfortunately, many people experiencing these symptoms are dismissed by their healthcare providers. Have you ever been told that period pain is normal or just part of being a woman? That's gaslighting, and it leads to an average delay of 7 to 8 years in getting diagnosed. If your pain is disrupting your life, making you miss school, work, or social events, it's time to find a doctor who will listen. Very interestingly, there are also symptoms that are uncommon and may not be directly associated with endometriosis, when indeed they are related. Some individuals experience these ambiguous and uncommon symptoms, further complicating and delaying the diagnosis and treatment processes. Endometriosis doesn't just cause pain. Here are some lesser-known symptoms to look out for. Abdominal bloating, feeling like your belly is swollen or full, especially around your period. Constipation or diarrhea, especially around your period. Fatigue, a deep exhaustion that doesn't improve with rest. Frequent urination, needing to pee more often, especially at night. Ovarian cysts, persistent cysts on your ovaries that may appear on an ultrasound. Changes in your period, heavy bleeding, spotting between cycles, or irregular periods. Nerve pain, shooting pain into the back, groin, or down the legs. Depression and anxiety, living with chronic pain and medical dismissal can take a toll on mental health. Difficulty getting pregnant or infertility. Now let's review endometriosis and fertility. Many individuals associate endometriosis with infertility, but not everyone with endometriosis struggles to conceive. About 50% of those with endometriosis may experience fertility issues. One reason it's often diagnosed during fertility evaluations is that stopping birth control can cause symptoms to flare up. If your symptoms worsen after stopping hormonal contraception, it's worth asking your healthcare provider about endometriosis. The most important thing is to find a healthcare provider who listens to you and helps create a plan tailored to your needs. Here are some essential questions to ask your doctor if you suspect you have endometriosis. Do you think my symptoms could be endometriosis? Be direct and clear about your concerns. What tests or evaluations can we do to investigate this further? Keep a symptom diary to help your doctor understand your condition, especially to show whether your symptoms are related to your period. A record of other or accompanying symptoms would also be useful for your health care provider to understand your situation. What are my treatment options, and how can we create a plan? Discuss both medical and surgical approaches tailored to your needs. How best can I plan my fertility? Discuss your wishes for a family, including when and what options are available if your fertility is affected. Your primary healthcare provider should examine you and, if possible, refer you to a specialist gynecologist for further examination, diagnosis, and treatment. Remember that endometriosis can be diagnosed both clinically based on signs and symptoms and by performing a laparoscopy, which is the gold standard for diagnosing. Diagnosing endometriosis can take time. You may need several appointments with your healthcare provider. It can be a challenging condition, both physically and mentally, but remember, you're not alone. Your healthcare provider is there to listen and help. It might be helpful to join a support group as well, and your healthcare provider should give you the necessary information about this. But once you have been diagnosed, what then are the treatment options available? If you have endometriosis, there are two main treatment approaches: medical and surgical. Medical treatments focus on managing inflammation and hormonal balance. Progesterone-based birth control pills or IUDs are commonly used in addition to anti-inflammatory pain medications. Hormonal contraceptives act by thinning the uterine or womb lining and slowing down the disease process. However, if symptoms persist, surgery may be an option. Excisional surgery, performed by a specialist, can dramatically improve quality of life by removing endometriosis lesions. But both these treatment options have downsides. The medical treatment involving hormonal preparations may not be suitable for some individuals, while for the surgical treatment, research has shown that the endometrial tissue may return in about 2 years, meaning surgery may not be a cure. Complementary treatments such as physiotherapy, heat therapy, like warm baths, diet and exercise play a major role in managing endometriosis. Check out one of my videos about the endometriosis diet. Endometriosis is more than just painful periods, it's a serious condition that deserves attention. If this video helped you, don't forget to like, subscribe, and share it with someone who might need it. Let's keep learning together.